think Medicare is only for anybody that's 65 or over? Not always. If you've been on disability or Social Security disability income for 24 months, your card probably has already arrived. Welcome back to Medicare Uncomplicated. My name is Sebastian Correa, local health insurance broker here in Ocala and the Villages, Florida. When most people hear the word Medicare, they think 65, when you're old, and that's something that's probably much later in the future. But millions of America are actually receiving Medicare much sooner than age 65. And that is because they have some sort of a disability. If you've been working for a while and unfortunately you end up with a disability and you end up collecting disability income, they get approved and everything, after 24 months you will be receiving Medicare. Your card automatically shows up in the mail. The problem is that the rules are very confusing. Sometimes certain disabilities qualify you for Medicare, some of them don't. Some might be temporary, some of them are not. For instance, if you maybe been on disability but decided to collect a spousal's Social Security income over Social Security disability income, you may lose Medicare or might not even have that benefit at all. And some folks that have been saying they've been on disability, talking to other folks thinking, hey, when is that Medicare A and B card coming in the mail? And you're just looking for a card that's never going to be coming. In this video, I'm going to clear that confusion. We'll cover the standard 24-month waiting period. And there's actually two conditions that will waive that waiting period altogether that gets you Medicare immediately. We will also tackle the biggest fear some folks have in disability is whether they can work. Let's uncomplicate your disability together. So as you've probably seen already, today's topic is the Medicare shortcut and getting Medicare before the age of 65. You're getting this through having disability. If you have disability income, so this is SSDI, if you're getting a check from the government and it on the letter says Social Security disability income, not to be confused with Social Security income. Social Security income is where you're retired. The disability income is where you clearly have this income from a disability. If you've had a check coming in for 24 months, very likely you're going to get a Medicare Part A and B in the mail. And actually that card arrives 3 months before that 24th month. So you'll probably be seeing that card basically on the 21st month. And keep in mind, because you get that card early, just know that those benefits, it says it on the card, but it will start on the 25th month of you having disability income. What some people don't realize is as soon as that is active on that 25th month, that Part B premium is going to be deducted from your Social Security, unless you have Medicaid. But many times that $202.90 for 2026, that Part B premium will be deducted from your typical disability check you've been getting for the last 24 months. So you've probably heard of some people saying, well, I got Medicare immediately after I got a disability. And that is true for two unique conditions. So have you ever heard of ALS, a condition where you basically qualify for Medicare immediately? So if you're ever diagnosed with this, we need to get the paperwork rolling. Most of the time, if you're at a hospital, they help you with this process, but sometimes they don't. And this is a good idea to say, well, I have ALS. You will be getting Medicare within weeks. The other exception of waiting that 24-month period on disability is something called end-stage renal disease, ESRD for short. And just like ALS, you should be receiving Medicare within weeks. Now let's talk about some of the fears that everybody has. Let's say you've been on disability, you're tempted to start working. Can you lose disability and can I lose my Medicare benefits? The answer is yes, but you can still work and there's some limitations here. So if you're collecting SSDI, disability income, and you are wanting to work for 2026, that limit barrier is $1,500 a month. So try to look for a role if you're looking for work that is not going to pay you more than $1,500 a month. Once you pass that threshold, you're at a very high risk of potentially losing disability income altogether and definitely losing your Medicare. Now there is a chance you could potentially have more of an income in disability, and it's for unique disabilities. For sometimes the disability is a bit different for anybody that's blind. there might be an income that could be higher than the $1,500 for them. Now, I did have a gentleman that was in disability for quite a few years, but very luckily, he actually started feeling better and felt like he just wanted to get off disability. What was really unique about this is he was scared that he wanted to go back to work. He wanted to make more money and kind of stabilize himself, but he was scared to kind of lose his Medicare benefits as he was going through this progression period. And the truth is, you're not going to lose Medicare benefits right away. So this was kind of a relief for him, because you have about 9 months of Medicare once you lose that disability income. And unfortunately, what's very unique about this is a lot of folks that, let's say this is the primary income that they used to have was their income. They became disabled and now their disability income is very low. They could barely survive on it. And now they're about to hit that 24 mark. And they're really having an issue because, well, now they're going to be taking out an extra $202.90 out of their social disability income. What are they going to do? How are they going to pay bills? Well, they do have the option to enroll into other programs like Medicare savings plans or Medicaid. And so we'll have another video for that, and feel free to just check it out in the next video.